Today, NFL legend Brett Favre announced that he was recently diagnosed with Parkinson's disease.
Dr. Payal Kohli joins us now. So first and foremost, what is Parkinson's disease? Break it down.
Yeah, Parkinson's is an adult onset disease. So usually don't get it in kids, but it's a degenerative disease where the neurons in our brain that process our movement centers, sometimes our mood, these are called dopaminergic neurons, they actually start to break down. And so it can be really devastating because it can come on suddenly, progress over years, and we don't really have treatments or cures for it.
So you could really wake up and have some symptoms?
Yes, exactly. And so one of the most common symptoms that people actually experience as a first onset of Parkinson's is what's called a pill rolling tremor. So think about holding a pill in your fingers and rolling it. So you're just sitting there and you get this kind of pill rolling sort of motion. That's pretty classic for Parkinson's. Now, some people have something called an essential tremor, where their hand kind of shakes when they're trying to do something. I don't want you to confuse that with Parkinson's. That's benign and unrelated. But this pill rolling tremor is a classic sign of Parkinson's.
Brett Favre is 54 years old. That sounds young to me. I don't know a lot about Parkinson's, but what is the age range that you usually are diagnosed or the symptoms start to form?
Kind of, this is on the younger side. So you can see it between 50 and 85. There's actually a young onset form of Parkinson's that can happen before the age of 50. If you're diagnosed after 50, your Parkinson's tends to be more rapidly progressive in terms of that. And with causes, we don't really know what causes Parkinson's. We're starting to learn a lot. We know there's genetic tendencies, so it tends to run in families. We know men can have it more than women. And in his case, repetitive head trauma has been linked to the onset of Parkinson's as well. The idea here being something hits your head, you cause damage to those dopaminergic neurons, they have inflammation, and then they start to degenerate, causing a lot of those symptoms.
And it does progress? So what are the symptoms? How do they progress? And is there a way to stop the progression?
So that's the tricky thing with Parkinson's. It looks different for every person. So some people will have more of the movement problems. So I talked about the pill rolling tremor. There's something called shuffling gait. So I remember in medical school, the person that I met with Parkinson's, he has this mask facey. So it looks like he's wearing a mask, no emotion. He walks with a little shuffle because he can only take small steps. He has a pill rolling tremor. And then he has something called rigidity. So you try to pull his arm and it kind of gets stuck and all his movements are slowed down. That's called bradykinesia. So that's kind of the classic presentation of Parkinson's. You could have mood problems, you can have dementia, you can have sleep problems, you can have cognitive issues. So it can look very different. Some people have a lot of dementia, not a lot of movement issues. Other people will have more of the movement issues. So it looks very different for every person.
And obviously no cure, but is this something that Brett Favre essentially is going to have to deal with for the rest of his life?
It is. So we just kind of treat the symptoms. So now it's a problem with the dopamine neurons. So we give you back dopamine. Carbidopa, levodopa is the most common treatment. And we try to prevent further degeneration. In his particular case, I would be really interested to know whether or not this is CTE, chronic traumatic encephalopathy, which can present with Parkinsonian type symptoms. So, obviously we don't know how he was diagnosed. There's no kind of pathognomonic test. It's a compilation of your clinical presentation, your risk factors, and how your imaging studies look. But could this be something else? Could this be a Parkinsonianism type of symptoms rather than actually Parkinson's? But it's sort of treated in the same way.
Sad. It really is.
Such a surprise to get that news
It
today.
is. I know.
Dr. Kohli, thank you.